The MOSAICC trial is an epidemiological study, and what we have done, because it's a pilot study is already done, is that we have set up a study to look at different ways of studying the epidemiology or the causes of myeloproliferative neoplasms in a group of patients who have myeloproliferative neoplasms. We tested a number of different factors as part of the trial to work out what were the best ways of gathering epidemiological information with a view to then running a larger trial. The things that we looked at is, first of all, recruitment of cases and controls, because there are issues as to how you get good controls in a trial, get people to agree to come to be controls. We also looked at the questionnaires, the gathering of information, a questionnaire that would test across all the factors which we wanted to look at, and a way of doing this by telephone. As part of the trial, we also did quality of life on all participants, both patients and controls, and we looked to see could we collect biological samples so that we could then have a DNA collection for further studies. The trial was very successful. It recruited 106 patients, and the object was to recruit 100, and 126 controls. Controls were of two types. We looked at recruiting through GP practices, so random people attending their GP, or family non-blood relatives. In other words, that the patient would be asked to get relatives and friends to volunteer as controls. In that, the non-blood relative family friends was a much more successful way of getting controls than GP. So that's the first outcome that we would take forward, that in a larger study we would just look to do friend-family controls. Collecting samples was highly successful in that all participants were happy to provide a sample and did so. And we did quality of life on all patients and controls. And that was very interesting, because for the first time ever, the quality of life questionnaire was given not just to patients but to controls. And we saw highly significant differences in symptomatology in the patients compared to the controls. In other words, the patients had a lot more symptoms and significantly scored higher in many of the symptoms than the controls. We also, in the study, developed and had the questionnaire, which tested across all the areas of exposure, lifestyle, occupational exposure, to collect that information and develop that so that it's up and running. The study was a pilot study, and it was actually designed to test all those factors that I have said, to see what was the best way of running a study. However, we actually collected sufficient data from the questionnaires that we were able to analyse that and see if there were any factors that came out that were significant in the patients compared to the controls. And there were a number of things were significant. The things that were associated with myeloproliferative neoplasms were lower social class and household density in childhood, which of course may be linked things. So by that I mean that a higher household density, more than one child per bedroom, was more associated with myeloproliferative neoplasms than controls. Other things, perhaps unsurprisingly, smoking at any time was associated, and numbers of previous CT scans, but that may have been related with the disease itself. We also found some things that were inversely related to the development of myeloproliferative neoplasm, in particular alcohol, was inversely related. And a number of things that had been in other studies, other previous smaller studies, were associated with myeloproliferative neoplasms did not come out as significantly associated. So that is all done and published, and we're now planning and hope to very soon have raised enough money to run a definitive study. Having tested the methods, we then take those methods forward, the best methods, and would hope to run a full MOSAICC study, which would the starting point would be to try and recruit 1,000 patients and up to 2,000 controls, and then roll over all the information from the pilot study into that study, and then we would have a very large epidemiological study. Actually, MOSAICC pilot is actually the largest epidemiological study that has ever been done, but it's still only 100 patients and 200 controls, whereas you need to do, those by a factor of 10.